Welcome to Mindful Thinking Agency's Diversity Awareness in the Delivery of Healthcare Training for Clinicians. The overarching goals of this training are to create awareness within clinicians how women of color face challenges because of disparities when accessing prenatal care. The challenges that we will present are socioeconomic status, cultural linguistics, and institutionalized racism. Given the information provided, clinicians can work efficiently and communicate with these women about the services that their local hospitals and clinics provide. Now, we will discuss the challenges in more detail that women of color could face when utilizing prenatal care. Black, Hispanic, and Native American mothers are more than twice as likely as white mothers to receive either late or no prenatal care. Mothers who receive inadequate prenatal care are more likely to experience preterm birth, fetal growth restrictions, fetal demise, and maternal mortality. These women are 3 times more likely to deliver low birth weight babies, who are 5 times more likely to die prematurely. We can use the health belief model to initially describe the notions of women of color with prenatal care setbacks. The health belief model has 4 subsets: perceived benefits, perceived barriers, perceived threat, self-efficacy, and cues to action. If a woman of color does not perceive value in engaging with health promoting behaviors, then she will not receive the care that she needs. The lack of knowledge can create adverse health outcomes described previously. If women don't acknowledge to seek out PNC, it won't trigger positive engagement with the maternal health system. Let's look at how socioeconomic status is a barrier for prenatal care among women of color who are covered by government-regulated health insurance like Medicaid. Women of color have more difficulty accessing prenatal health services because Medicaid is not widely accepted by many healthcare providers in the United States, though Medicaid participants have access to all healthcare services. Due to a small number of physicians who accept Medicaid, there are longer wait times in receiving initial prenatal care. Uneven distribution of services creates barriers for women of color who are low income, considering they demand more prenatal services than their white counterparts. Considering the health belief model, the likelihood that women of color will take action to receive adequate care during pregnancy will decrease due to the barriers presented within the healthcare system. This directly causes more stress on women of color and decreases their likelihood of seeking affordable prenatal care. We continue to use the health belief model to analyze the perception of prenatal care among women of color, which can be influenced by a woman's attitude towards her pregnancy. Cultural beliefs influence the attitude towards prenatal care. In some cultures, pregnancy is seen as a normal event and regarded as a healthy condition where mothers may not seek physician advice or medical treatment. Similar to cultural barriers, language is also a barrier in establishing a good physician-patient relationship, along with fostering open communication. Keep in mind that to learn a language is not the same as understanding a culture. Moreover, the perception of what constitutes a health problem usually varies between patient and provider. Physician-patient communication is necessary for gathering information from the patient to effectively counsel them through the correct actions in prenatal care. It's less likely that patients make the informed decisions without a proper understanding of their pregnancy and associated obstacles. Poor communication makes health literacy a great challenge. Institutionalized racism is defined as differential access to goods, services, and opportunities by race. Institutional racism may affect health through negative health behaviors, such as delays in prenatal care utilization and treatment non-adherence. For instance, many studies have shown that there are lifelong accumulated experiences of racial discrimination of African American women that constitutes an independent risk factor for preterm delivery. Due to this issue, most women do not seek prenatal care until their 3rd trimester. There are multiple actions that clinicians can take to alleviate the preconceived barriers in receiving prenatal care among women of color. What can clinicians do? We can continue to use the health belief model to explain effective solutions. Clinicians can increase their effective communication skills with patients by taking time with them and sharing prenatal information within an open space that facilitates questions. This effort will increase trust, which in return will encourage the clinicians along with the patients to learn about the challenges that women of color face in prenatal care and how to overall combat these obstacles as a team. Furthermore, clinicians can provide flexible hours and scheduling, which will encourage more women to visit their facilities during the hours that they have available. There are an array of suggested solutions for clinicians. If you or another clinician would like to receive more information, please click on the link.